Okay, Dr. Mufeng, my next question now is, what are the treatment that you offer in FUDA Cancer Hospital?
We have many techniques which are maybe the latest techniques from USA and from European country. We also have some techniques of our traditional Chinese medicine. The first and very famous treatment is cryoablation. It was invented in USA and it has been approved by USA FDA. And we finished more than 10,000 cases with these techniques to destroy the tumors without any open surgery. And with these techniques, we only use several needles. We can insert these needles inside the tumor and freeze the tumor under the temperature of minus 150 to minus 170 degrees Celsius. Under this temperature, all the cells will be frozen to death, so that we can control the tumor. If the tumor is resistant to chemotherapy, to radiation, or if it is inoperable, then we can choose this treatment to control the tumor. And we also have another techniques from USA. This is called irreversible electroporation. Another name of this techniques is nanoknife. It has been approved in 2012 in USA, and until now in the world around 6,000 cases has been finished. But in Asia countries, we are the pioneer. Now these techniques can only you can only get these techniques from Taiwan, from China, mainland, and Hong Kong, and Japan. And in our hospital, we finish more than 250 cases, mainly for advanced pancreatic cancer and liver cancer. Also, we did these techniques for some lung cancer patients, and all of them benefit of these. According to Professor Martin, the pioneer of nanoknife, his report show a very good result. The patient can double their lifespan under these techniques compared with the traditional chemotherapy. And we also have brachytherapy. We can use the particle brachytherapy. We call it iodine seed implantation. Use these techniques, we can avoid the side effect of the traditional or conventional radiation. And we can also increase the dosage in the tumor so that we can more effectively control the cancer. This has been widespread use in USA also, in China also. And our Dr. Niu is also the vice president of the Chinese Association of this brachytherapy. And for some cases, when the radiation fails, we can also use this, especially for nasopharyngeal cancer, for the central lung cancer, for liver cancer, or other cancer resistant to radiation. We can use this. And we also have thermotherapy. We have HIPAC to treat the malignant ascites and malignant pleural effusion. We also have the microwave thermotherapy to treat the patient with cancer in the chest and the abdomen. And also we can use these techniques to prevent the recurrence after treatment, especially for the cancer breast. Yeah, because the cancer breast sometimes can relapse. And use this is very simple and cheap. And patient undergo this, patient feel very comfortable because we only use the temperature 43 degrees Celsius to warm the body so that it can kill the cancer cell. And because cancer cell is more sensitive to temperature, to high temperature, so under this temperature, the normal cells can survive, but the cancer cells will be killed. And we also use local chemo or interventional chemotherapy. We use the microsphere to absorb the chemo medicine and then inject this kind of particles inside the tumor. So that this kind of particles can stay inside the tumor and release the chemo medicine for 2 weeks. So with these techniques, we can increase the concentration of the chemotherapy, chemo medicine inside the tumor, and we can reduce the side effect of radiation. This is usually used in liver cancer and breast cancer and some liver metastasis from colon cancer. We get a very good result. Even if the tumor is very big, it will be disappear after this treatment in many cases. And also we have some other techniques like immunotherapy. Now we use the cell immunotherapy and also the antibody immunotherapy. With with the cell immunotherapy, we use the DCCIK therapy and the NK cell therapy. And we also use the antibody PD-1 to treat patients with cancer, especially for lung cancer and gastric cancer, the colon cancer, and the melanoma. And patient can benefit greatly. Yes, with the NK cell and the DCCIK cell treatment, we draw the patient's blood sample and select the immune cells, DC cells and NK cells in the lab, and then we amplify these kind of cells, and then we transfuse these cells back to the patient's body to enhance their immunity. And with these techniques, we can prevent the recurrence after chemotherapy. We can enhance the patient's immunity after chemotherapy because chemotherapy and radiation will damage the patient's immunity. And also we can use these techniques to treat some cancer which are not sensitive to chemotherapy. So we recommend this to all our patients. Of course, as a doctor, we need to know how to choose these techniques, how to make a good dishes with so many ingredients. And as a doctor, we need to know for the late-stage cancer patient, individualization is more important than a conventional treatment. And in our hospital, so we think with the individualization conception, many patients benefit more in our hospital. We don't emphasize chemotherapy very much in the late stage patient because patient can benefit very less. Or for some patients, they only continue chemo. Then the chemo will kill the patient in this condition. And we can choose other techniques to compensate the chemo's advantage and avoid the disadvantage of the chemo. Okay?
Okay, thank you. Wow, that was wrong. So
I'm
yeah.
not sure whether you can understand.